Breakfast, good morning to you.
New guidance is to be issued to doctors on how to relieve the suffering of patients who are thought to be dying. It follows complaints about a controversial care model that allows food, drink and medicine to be withdrawn from terminally ill patients.
As the Health Secretary, Jeremy Hunt, will outline new rules tomorrow. He says patients and their families must be consulted before a decision is made to put a patient on the end-of-life pathway.
Well, from our Birmingham studio is Rustie, who says doctors withdrew food and drink from her mother without consulting her family. Here in the studio is Priestley. Her father died this summer and received end-of-life care in hospital. Thank you for joining us. Thank you both for joining us. Kimby, let's just begin with you. Tell us what happened.
Dad had been ill for quite some time, and then he ended up in intensive care when his kidneys failed near the end of his life. And intensive care had a conversation with us and asked, you know, what was his wishes, and we explained that he didn't want to have a life where he had pretty much no life, and they discussed with us about pathway, and we believe that was the best decision for him and for us.
So you felt informed and in control as much as you could be in that situation?
Absolutely. They explained that there was nothing else they could really do for him, that he wasn't really going to have any kind of form of good life, and they took us through what pathway meant, how it was going to be implemented, and yeah, we felt it was a good decision.
And if you don't mind, just explain what it meant in terms of what pathway is, because I think unless people have been in that situation with their own loved ones, they might not necessarily be familiar with it.
Yeah, they explained to us that they'd take out all kind of invasive medical treatments, so they'd take out all the tubes, any kind of feeding tubes as well, and then they'd give him food and water when required, and pain relief as well, as and when required, and that was definitely done.
OK, let's talk to Rustie, because Rustie had a slightly different experience. Rustie, it's good to speak to you, good to have you on the programme. Thank you for joining us. Just again, the same question, tell us what happened. What was your experience?
I had a phone call from when my mother is in a home. She suffers with dementia, and as I know, she had a chest infection and was rushed to the hospital. On getting to the hospital, we were told, called into a room to say that my mother had 24 to 48 hours to live. I was extremely shocked and upset. They said that she was suffering and she was in pain. And I said, you know, okay, we went along, because if a doctor tells you that someone's poorly and near to death, you have to believe them. We stayed with our mom and fed her because she seemed very hungry. On feeding her, she was happy and started singing and dancing in the bed. I was massaging her leg and asked her if she was in pain, and she said, yes, my foot hurts. So I went to the nurse's station and asked her if I could have her medication that she normally has for dementia and pain and all the different painkillers. I was told that she wasn't going to have any medication, and I wanted to know why. And cutting a long story short, they said that she was going to be put on, when she became really in pain, she was going to be put on morphine and another drug called mazola, something similar to that, and to take her out of her pain. And I said, I was absolutely flabbergasted, because I didn't know what it was, and they explained that what this pathway was. I said, excuse me, I've got no idea what you're talking about. I don't want my mother on a pathway, and I was furious about it because my mum was singing and dancing. I'm sorry,
Rustie. So your claim is that you effectively took her off the pathway. You started feeding her and giving her drink, and that she's okay now, yeah?
She's absolutely. I have to say, she's back in hospital at the moment. I've just come away from there. I've been with her several nights now. She's still poorly, but I don't want to put on a pathway. I want nature to take its course. I was never told about this, and I think that people should know and be consulted on a situation so painful to you to hear this.
Yeah, I mean, Jeremy Hunt, the Health Secretary, will announce plans tomorrow for the way pathway will be used in the future, and he's talking about involving families far more. How aware do you think, in your experience, families are of what a pathway is and how it works?
I don't think people are aware of it at all, because I had never heard of pathway. when they told me about this, when I went back to tell my family, I could hardly speak because I was so shocked. They kept on asking me what had happened, and I asked them to let me. I was hyperventing, I couldn't speak. So definitely, I'm so pleased that Jeremy Hunt is doing something about this tomorrow, and I hope that people will be aware of what's going on. Don't be afraid to ask doctors what's going on, because if my mother didn't have me, to shout up for her and protect her against this, she would have been gone by now. 24 to 48 hours was the prediction, and for sure she would have gone, and she's still with us.
We should just say we have had a statement from Birmingham City Hospital where Rustie's mum has been treated, and just explain that staff say that the hospital says that staff did explain to the family that they were putting Rustie's mother on a supportive care pathway and that she was offered food. When hospital staff became aware of the family's concerns, she was removed from the care pathway and transferred to another ward for her recovery, where a senior sister and doctor again spoke to the family to further explain the pathway and reassure them. But obviously, as we've heard from Rustie, many more families feel they need more explanation, don't they?
But Kimby, it's interesting because you got in touch with us this week, having seen a discussion on Breakfast about this.
Yep.
Because you wanted to say that, you know, in your case as a family, you felt involved. So maybe, I mean, obviously Rustie's experience, she says, is very different from yours, but you were effectively satisfied at the way it was handled in your dad's particular case.
Absolutely. I mean, I think maybe we were lucky, but we were completely informed throughout the whole process. And because we were lucky enough to have already been having to have those discussions with Dad, we knew what his wishes were. So for us and for him, it was the right thing to do. OK, Kimby here on the sofa, thank you. Rustie in Birmingham, thank you both very much indeed.
Thank you very much.
It's a delicate debate. Thank you for sharing your individual cases with us. And I'm sure there'll be much more on this week as Jeremy Hunt outlines the government's plans. It's just after 7:15.
You are watching Breakfast from BBC News. Let's bring you the main stories this hour. Barack Obama